هذا المؤتمر. وتفضل. إذا ننتقل للنكست سبيكر.
دكتور محفوظ باسلوم مع موضوع النيوناتال دي في تي كومبارتمنت سندروم اند فليجميزاسيون لادولانس كيس سيناريو.
بسم الله الرحمن الرحيم. Case presentation: neonate DVT compartment syndrome and phlegmasia cerebralis. Our case: neonate 14 days old, full term, via normal vaginal delivery in the hospital. The patient complained of bluish discoloration of the right lower limb for the past 2 days, associated with mild fever. No history of trauma or insect bite, no any previous medical complication, no any hospital admission or vaccination. Feeding history, breastfeeding well, no family similar condition reported. Physical examination: patient general conscious, alert, active, well dehydrated, with no pallor or jaundice, vitally stable, only elevated on the temperature. Chest examination: good air entry bilateral, no additional sound. Cardiovascular system: heart sound S1, S2, no murmur. Abdominal examination: soft abdomen, no distension or organomegaly. Physical examination: there is bluish discoloration from the toes to the thigh, and the swelling presented, no bulli or tissue loss. Cold, tense, tender, pulse absent in distally dorsalis pedis, but palpable in the common femoral artery. Knee stiffness and ankle stiffness. No spontaneous movement. Radiological evaluation: normal X-ray of the pelvic and both lower limb and chest, and echo was detectable or normal result. Doppler ultrasound show there is right external iliac vein and common femoral vein dilated and uncompressible, presented with intraluminal thrombus material. But the superficial venous and the distal venous we cannot assessment due to the severe soft tissue edema. And all arterial system was normal to the anterior tibial artery. Lab investigation: WBC 12, HB 11.5, platelet 2099, C-reactive protein 12, BT 13, BTT 20, INR 0.9, serum urea 25, serum creatinine 66, serum potassium 3.9, negative viral marker. Diagnostic: phlegmasia cerebralis. The plan: orthopedic consultation to exclude any fracture and dislocation. Documented by orthopedic surgeon, there is no fracture or dislocation. Immediately prepare patient for fasciotomy and pediatric ICU heparinization. This is 0 day post fasciotomy, and this is second day. 5 day post fasciotomy, patient enter in bleeding from the fasciotomy of the foot and thrombocytopenia and leukocytosis. We will discuss this problem with the pediatric surgeon, with pediatric consultant, how to management patient need to anticoagulation and patient enter on thrombocytopenia, and maybe possibility cause heparin-induced thrombocytopenia or the sepsis. We, the pediatric consultant, we cannot change the heparin or the low molecular weight to the fundamental rocks. because we can no study or any document for fundamental knocks in the pediatric. And how to manage this problem? By platelet transfusion and given low molecular weight for this patient. And the relative refused to do any thrombophilia screen. 10 days, on the 10 days post-fasciotomy, improve observation of the platelet count increase, and leukocytosis decrease, and discharge plan, patient discharge after plastic consultation for close the fasciotomy, and discharge on the low molecular weight therapy. But the plastic surgery, we cannot close it, the fasciotomy at this time, because the limb is edema. And this is follow up after 55 days. There's full healing of the limb and functional limb. Introduction, phlegmasia cerebrolaris is a rare complication of the deep venous thromboembolism, lead to acute limb ischemia due to near complete or completely or to the venous system. Clinical picture, marked edema, pain, cyanosis, paresthesia, in severe case may be progressive to gangrenous. Epidemiology, more complication this problem in adult, rare in the pediatric population, but the incidence in the pediatric 0.07 per 10,000 children. Uncommon on the otherwise healthy child. Medical significant, real uncounted in the clinical practice, potentially severe complication if not promptly recognized. Timely diagnosis intervention are crucial to prevention and different outcome. You do research of this case. We cannot not found any paper about this case. Only this phlegmasia cerebri we can see in the patient 7 years. This is patient can handle external iliac venous occluded and the inferior vena cava. Management this patient by mechanical thromboembolectomy. أولاً catheter direct thrombolysis by catheter direct thrombolysis. And this case, this paper in the 2020 in America, the patient is 12 years old girl, can't have the COVID-19 and severe acute respiratory syndrome and pulmonary embolism. How to treatment this patient? Put patient in the ECMO and do mechanical thromboembolectomy. And this is guideline on the Texas University to discuss who is the patient have risk of venous thromboembolism, can to do medication anticoagulation of this patient. But this study is for the patient more than 14 years. Home message, phlegmasia is the serious complication of the DVT that can lead to the loss of the limb of not management immediately. Early intervention can to improving the outcome and preventing the complication. In a rare case, can seeking to multiple expert opinion to my beneficial. Treatment decision should be prioritized to available option that is both effective and safe to the patient. Thank you for your attention.